everybody, and welcome. Today I'm very pleased to welcome Professor Andrew Thompson, who you may recognise because, Andrew, we've worked together for many, many years across many of our skin clinics, haven't we? So a lot of our members will definitely be aware of you in very kindly answering their questions. But anyway, welcome. Be great if you could tell everyone a little bit about you, because I think in the years I've known you, you've moved around a bit in a positive way.
Yes. Yeah, I'm moving around a bit more now COVID's finished, because of course we're all trapped, weren't we, for a period of time. So I'm Andrew Thompson, and yeah, we've worked before, haven't we? And I've answered a few questions relating to well-being and psychological functioning associated particularly with skin conditions, but more widely, I think, with conditions that affect appearance. And I'm a consultant clinical psychologist and a professor of clinical psychology, and I'm now based in Cardiff on the South Wales Clinical Psychology Training Programme, which is within the School of Psychology at Cardiff University. So yeah, thank you for your continued interest in this area. I mean, it's an area that, funnily enough, hasn't had as much attention as one would think, given how common skin conditions are and given how important body image is to all of us.
Although I think people are becoming more and more aware of it, although they might not necessarily talk about it as being skin. It's about appearance, isn't it? Which is obviously what we're going to talk about today, appearance, but relating very much to skin. Although I think people quite often don't narrow it down to being skin, but it's sort of, that is obviously one of the biggest issues. Well, skin being the biggest organ that we have on our body.
Yeah, and terminology matters, and certainly when we're trying to support people, we want to understand the language that they're using when they're talking about themselves. And obviously, we could, in terms of skin conditions themselves, we're talking about a huge array of different conditions, including diseases. But I guess obviously our skin and our complexion can be affected by other things as well, obviously as a result of accidents and injuries, and other diseases, of course, as well.
So when we talk about body image, and we all have our own different interpretations of what our body image is, what we think about our body and our skin, and then we talk about things like body dysmorphia. And, body dysmorphia can cover a whole range of things, so we could be absolutely paranoid about having a single blemish. And with that, I mean, tell me how you would describe what body dysmorphia is.
Okay, so I guess a lot of my work has been concerned both within the NHS in terms of supporting people, but also in terms of my research, is really understanding appearance-related concern associated where there is an actual visible change to the body. So that's where a majority of my work lies. But of course, it overlaps very much with more normative worry about body image. And I bet most people watching this, will have thought about their body image to some extent today already. When we all do, it's very normal to, be concerned about what we look like, and we put effort into getting ourselves ready in the morning, and so on. And often it's very common to have some form of minor concern. There's also an overlap with what you said in relation to body dysmorphic disorder, which from a psychiatric point of view, we would describe as a very much an over focus on a perceived flaw on one's body, to the point that someone becomes very distressed about that, and it actually impacts on their ability to enjoy their life or go about daily activities. There are the various nuanced features and symptoms that we'd look for body dysmorphic disorder, and people can of course have that without any objective alteration to their body, and often we'll see that. And so you'll see people who might typically be, they won't typically come to seek psychological support in the first instance. They'll often be looking for a surgical answer or a cosmetic answer to address that perceived flaw. So they might be searching for, you know, a rhinoplasty, change their nose, or some, if it's related to skin, they might be looking at additional products or surgery or laser treatment to alter their complexion. So that's the sort of thing we'll see. But of course, you can get what we might call an overlay of that, where there is an objective difference to the skin, but it's quite complicated, because I think particularly in relation to objective conditions, by which I mean diseases or accidents, you know, where there's something actually on the body, it's not just something that's there in someone's own mind. There is a reality of discrimination at one extreme. And also, you know, some conditions can be very noticeable to others, and people may not understand what they are, and that can attract unwanted attention that can be burdensome. So you know, basically, I think there's a variety of things that we might be interested in from a psychological point of view, trying to support people with an objective condition that affects their body and the appearance of their body. Trying also to support people where they're overly concerned about the appearance of their body, where there might not be an objective condition. And also, you know, to some extent, worry about appearance is normative, and there are certainly self-help techniques that can be used to support people where it's not tipping into what we might call a clinically significant problem, but it's still nevertheless, you know, causing them some distress periodically.
I think, and that's the main thing, isn't it? It really is how is it affecting that person? So it's almost, it doesn't matter whether it's really there or in their mind's eye or whatever. It's the fact it's causing them. And I know that we're going to talk later on about how, you know, techniques about how you come to how to be at peace with the way you look, or to realize, to cherish what's the person as opposed to what they look like, you know, which then sort of leads on to, you know, social media is obviously a huge, I'm sure that social media, has it changed how people perceive themselves, or do you find that with your clinics?
I mean, the wider context for these things is always really important, and that includes social media and just wider society. So, I mean, if I can just take it back to, say, conditions that do have an objective impact on appearance that other people might notice, such as psoriasis or acne, or any number of the skin diseases, you know, can be highly visible. And of course, that, you know, people with those conditions have a number of things that they need to manage, engaging with the treatments. There may be itch, there may be pain even with some skin conditions. So there's a whole variety of burdens that are going to have an effect on, potentially, on your mood from time to time, and that's just normal. But one burden that can be there is the actions of other people. And that, you know, that's like, you know, there could be staring, there are reports of outright discrimination in the workplace, people reporting being removed from jobs, or, you know, that there are cases of people being reporting having difficulties accessing certain leisure pursuits. So it's not always just in people's minds, and I think it's important to be clear about that, because that's something that we need to take a sort of what we call a biopsychosocial view of this, and look at the biological condition itself, whether there is a condition that's present or not. And if so, you know, what are the effects of that? The psychological issues in terms of what's going through someone's mind about it, but also what are they actually feeling? You know, how is this affecting them? And you can have a whole array of different emotions. But then also it's really important to be mindful of the context and the social context. Are they experiencing any discrimination or negative reactions? And what's going on for them? And just to go back to your actual question about social media, I mean, we live a lot of our lives online. You know, obviously we're doing this online. Back in the day, I would have come down to see you, and we would have sat around a table and record it. And, you know, there are pros and cons to that. We've got busy lives, But of course, we're also using social media to interact with one another, and people often alter their appearance in very deliberate ways. And people are also looking at things very quickly. And we all know that it takes time to get to know people. And often once you've been chatting to someone, you're much more interested in what they're saying and what they're doing than what they look like. But a lot of the social media is very instant. And we do know that humans do make some instant judgments, which can be negative around appearance, but they are usually overcome very quickly. Once you get to know someone and be engaging with them. And the other thing about, I mean, it's a complicated area actually, because there is quite a bit of evidence that alteration of appearance within the media, and I think that's been the case in magazines and newspapers as well as on social media, by which I mean airbrushing and that sort of thing. So enhancing appearances can have a negative effect on people. So there's a whole range of studies that have shown that, at least in the short term, if you sit and flick through a glossy magazine back in the day with lots of idealized images in there, of say of skin complexion, but also of more other types of beauty stereotype, it can lead to a negative impact on your mood, at least in the short term. And that's also true on social media as well. And that's true for people generally, not just for people with an objective condition. And so social media can have a negative effect. So I think it's really important that organisations like Changing Faces and other charities are taking a very positive stance in promoting normal people's images, and also images of people affected by specific conditions being put out there in the media in a positive way. I think that's really important to do that. I mean, I could carry on talking about this, because one of the things that you also see is that when people are distressed, it alters how they engage with social media. So, you'll know yourself, when we're, anxious or stressed, certain things happen. We become a little bit more ready for action. Now, that could happen when we feel threatened, and of course, being worried about what other people might think about us, being worried what we think about ourselves, can trigger that sort of physiological reaction, and we become much more alert and sensitive to spotting cues that are threatening. Now, that on social media, that can be someone, for example, who's worried about their complexion or their skin. It may be that they start to engage in more social comparisons. So they're looking at images on social media, and they're comparing themselves rather than necessarily even reading text. First of all, the first thing their eyes go into is someone else's complexion, and they're making some sort of judgment about themselves in relation to that. Now, the problem with that is those judgments tend to be negative, which then switches on more of the threat system and leads ultimately to distress. But what they're doing there is often semi-conscious. They're not deliberately going to go, right, I'm going to look on social media and compare myself. Sometimes people do, and you might get that in the more extreme body dysmorphic disorder, but often what people are doing is it's sort of semi-conscious, and they're falling into doing that. And it's not their fault. It's part of, us being human, when our threat systems are switched on, we make some more social comparisons if that's where the threat is, the perceived threat is, or we become sensitive to other cues of danger. So so it's complicated, but the short answer to your question is yes. Social media brings with it some of the old problems, and that's like around airbrushing and presenting over idealized images, which can have a negative effect on anybody. But also it presents its rapidity and the speed of it, and the increased access for everyone to to use filters and so on, I think can bring a particular set of problems for people. And we've done research that demonstrates that.
Yeah, I was just thinking something you said earlier about, particularly depending on whether, I suppose, for children with acne as an example, so I was thinking about something that affects children when they're young, and then and children, as we know, can be quite cruel to each other. And it's that stigmatisation that can occur potentially at a younger age. And as you get older, people obviously don't say so many things, but I presume for some people that can carry on through to their adulthood, and it needs to be sorted when they get later. Are those some of the issues you see?
Yeah, so again, to go back to this idea about how important the context is or our environment. Yes, both the person's current environment, i.e. what they might be encountering on a day-to-day basis, and of course the frequency of that makes a difference. It is important. So yes, people can be, whatever your age, people might with an objective condition may experience some degree of discrimination, or just some additional social burden of people sort of staring or commenting or that sort of thing. Obviously, but what you're intimating in your question is there an historical contextual fact for people, i.e. what's happened to someone if they've had a condition for a long time, or historically they had something that was visible and they received bullying. Yeah, absolutely, for sure, that has an impact on people. And some of the qualitative work that we've done, people really remember some of those negative things that were said to them in childhood about the appearance of their skin, and they can be very, very harsh. And that can almost, for some people, act in a traumatic way, in the similar sort of structures to we might see psychologically with a traumatic reaction. So yeah, if we're working with someone for psychological therapy, we'd be certainly asking not just about what's going on in their mind and how they're feeling in their emotions, but we'd be asking what's going on in their current environment, in terms of what they're having to deal with and the impact, but also historically how things have been for them. And we'd be sensitive to bullying, because I think bullying, does have a long-term impact. You don't need to be a psychologist to know that any form of bullying, particularly if it's been persistent, can have a dent on your self-esteem going forward. Through no fault of your own.
Yeah, is there anything that you would suggest that parents can do to support children? And I know we're talking specifically about skin, but I mean, really, it's open to any interpretation. Is there anything that you would advise parents to how they can support their children when they're, but then that there may be issues like that?
Yeah, I mean, it's tough being a parent anyway, and being a parent of a child with any form of long-term condition can have an additional burden. I mean, I think that before I sort of answer the question, but I think it's important to say that the vast majority of people with children and adults with long-term visible condition, whilst it does impact their mood from time to time, it doesn't stop them from leading complete normal, healthy lives. And people work through any of the issues that are associated with it. But in terms of what parents can do, I think and parents are very good at this naturally, it's being sensitive to what they see before them in their own child. You're the expert on your own child. How is your child doing? And some children don't always come home and go, well, at school today, I was bullied and somebody said this, that, and the other to me. They may act it out in a different way at home. And it's being sensitive to the parents, being sensitive to that and explore that. And then obviously to liaise with the school or the club if it's happening outside of school in some sort of leisure activity to raise awareness of that. And most organisations now have got well-developed policies for dealing with bullying. I think there's also preventative things that you can do. Some of that is having a conversation with the child to prepare them for how to deal with other people. And if there is something that's very visible and you might predict that other people might comment on it, I think there's something that you can do to help develop your child's abilities in all areas of their life, so they can be very confident in how they go about hobbies, for example. And we might talk about that later in terms of one of the things that have been proven to sort of work in body image generally, which is sort of growing pride almost in what your body can do for you rather than what it looks like. So I think parents can encourage that from an early age in their child, and that's a good thing for all of us as parents, to do that with our children, to put emphasis on, how lucky we are to have the body that we have that can do what it can do for us, both internally in terms of keeping us alive, but also, can lead us to do some pretty amazing things from a sporting point of view or a leisure point of view in terms of being able to run, walk, swim, whatever it is. And so I think we can help our children get involved in exercise. But I also think it's really important to, and of course parents do this naturally, which is to show the child that you really value them for them, and maybe to prepare them to deal with other people's negative reactions if they are receiving those. And there are some great resources out there as well from a lot of the Pacific skin charities, for example, have got tips on how to manage reactions of other people for children and adults. Certainly Changing Faces, it's a national charity that I'm a trustee for, do a lot of work with schools and have got packs and that can be used not just to deal with it when it's a problem, but actually also just to raise awareness of this, so that we can have it right. There are things that schools can do, but in particular in advance, to sort of nail down that appearance-related bullying's not acceptable. Just in the same way that any other type of bullying isn't acceptable. And we, as a school, you want those messages to be going out that, that this shouldn't be happening in the first place.
Absolutely. The reason I say it's particularly about acne, because we've done quite a bit of work in acne, and is how much a parent can help a child going forward, rather than just saying it's your age, is to be far more sympathetic towards them about, if you can do something. But you're right in preparing them that people do say horrible things, but children are children, and they don't always necessarily mean when they say those things, isn't it? And I suppose.
Yeah. I mean, one of the things that I've sort of been unfortunately amazed by is that it isn't just in childhood, though. There is bullying in adulthood, and there is quite intrusive comments. And that's why I think as healthcare professionals, particularly people providing psychological support, we do need to be very sensitive to that context and to explore with people what it is they're actually experiencing, like you said, both in the past but also in the present. But there is things that you can do, to manage other people.
But let's be positive now and say, okay, when people have these issues, whether they were children and it's carried on through their life, or that suddenly as an adult they suddenly find something's changed, because lots of people develop conditions as they get older or living with them. You hinted at it earlier, is actually valuing your body for what an amazing thing it is to start with.
Yeah. I think that's definitely true. That can be very difficult when people are very distressed. So very distressed, it goes back to the sort of threat system. Our perception becomes narrowed down onto that. And this is the same when we're anxious, but it's also in a different way, quite similar when we're depressed or ashamed, that we can become very focused on a perceived personal flaw. And in this case, we're talking about appearance. So it can be quite tricky to try and shift out of that. A bit like, we make comments when a certain biological system's switched on, whether it be the flight or fight system, or whether it be we're feeling aroused in some way. We like to say, oh, go and have a cold shower, switch that off. Our bodies are, when they're in motion, and they become quite set on that direction. And that's the same when we're depressed or anxious. So it can be quite hard just to go and think in a different way, or go and do something in a different way. So we rarely, for people who are sort of moderately to severe distressed, we'd rarely just give them advice. Right. We'd be spending time with them, getting to know them, and we'd be gradually helping them to manage reactions from other people where that's necessary, but also to manage their own reactions towards themselves, and also to rebuild their confidence by doing things. And rebuilding your confidence by doing things is so important. So it's actually learning, but it's just learning by experience. But it can be really hard to do that when you're low in mood, and that sometimes needs, you know, scaffolding and support. But for people where that distress is less intense, then certainly self-help materials can be really important. And there's a bit of work that's been done recently, just to go back to what you were saying, around growing confidence by focusing on what your body can do for you. So there's quite a lot of work that's been gone on around the use of various writing type exercises, but to help people to shift their awareness to developing gratitude, sense of pride over what their body can do. For me, it's also really important to actually use your body. So exercise is so important generally for stress management for us. Again, it's not easy to do, but forming a specific plan to do exercise and nudging yourself to do that can be so important, because it's not just, don't just get the buzz from the exercise. It helps you experience what your body can do and can shift your attention from the appearance element. But there are lots of other types of interventions that you can do from a self-help point of view. I mean, I mentioned briefly stress management. We know that, for example, there's a two-way street with some diseases, particularly sort of inflammatory diseases, where stress itself can certainly worsen or be associated with flare-ups of the condition. But also, obviously, the secondary impacts, the sorts of things we've been talking about, visual impact, maybe the burdensome nature of the itch or pain, or the burdensome nature of applying creams and so on, can be stressful in itself. And of course, reactions from other people. And there's certainly a whole array of tried and tested arousal reduction and stress management techniques. It can be really useful to use, particularly if people have got sort of more mild levels of distress, that doing those in a guided way, or even a purely self-help way by getting tips from the internet or from a healthcare practitioner, have been shown to be beneficial. And we've done some studies recently looking at that, but there are other people that have done that. And generally, the research for things like mindful-based breathing, guided imagery, and other forms of arousal reduction is pretty positive.
So there's lots of things. So physical exercise, so a lot of those things are the well-known mental things, and interesting that you mentioned sort of writing and creativity. So presumably that's about also getting out your expression and your feelings about things.
Yeah. I mean, one of the key things I think for us as healthcare professionals, and this I think is very true for physical healthcare professionals as well as psychological healthcare professionals, is taking an holistic view. So I mean, a wide-ranging view, like I said, looking at the biopsychosocial model. And it's really important to validate people and to hear about the impact, because it's not easy sometimes being human. You and I might have woken up this morning. I'm getting to a certain age now where sometimes when I get out of bed, I can get a bit of an ache, and I don't know how that's been caused. It's just part of getting up. It's and aging, and life can throw little stresses at you, and sometimes it can throw big stresses at you. An illness is a big stress, of course it is. And thankfully we've got a brilliant medical system, and we can treat a lot of conditions, but nevertheless, in the gap between getting the condition and it being treated, there can be stress. And certainly some conditions are obviously long-term conditions that need continued management. It can be burdensome, of course it is. We're not robots, we're humans. So it's really important for healthcare professionals to validate and hear about that distress and just acknowledge that it's, it is what it is to be human. And actually we can do that for ourselves as well. There's a lot of evidence that being people who are more naturally self-compassionate, have that as within their personality, if you like, can self-soothe and self-reassure. And we can actually teach people to do that. That people who are less good at it, we can actually work with people to develop that skill.
But at what point would you suggest, if you've tried, at what point should people go and seek professional help? Is there a certain mark where you think, yes, you should be, trying to have some extra support now?
Yeah, I always think it's important to be open with your healthcare professional, and we know healthcare professionals are very busy. So if you've got a long-term condition, I think it's very important to try to be as open as you can. And it's very important on the other side for the healthcare professional to ask about that. And that can be enough for a lot of people to feel heard, to feel validated, and to be signposted to some of the sorts of things that I've talked about, and also to some of the great charities that are out there as well. For skin conditions, there's a whole array of them. But in terms of when you would seek support, I think if it's really denting your confidence to live your life that you want to lead, it's stopping, certainly if it's impacting on your ability to function at work, to function in your relationships, or even to form relationships, or your ability to engage in leisure pursuits, or if you're very frequently feeling intense emotion, whether that's feelings of anxiety, shame, low mood, even self-disgust. We know our own bodies. We also know our own minds. So, if you're feeling that way and that level of distress, do seek support. And, obviously in the UK, we've got primary care physicians, GPs that people can talk to, but we've also got direct referral services for managing distress and feelings. They used to be called increasing access to psychological therapies, but their name tends to vary region by region.
So I think the message really is there's lots of things that one can do to recognize it in yourself. There's lots of things that you can do, self-help. There's charities that you can go to, and also go and speak to friends. I think that's or people that you trust. So quite often, isn't it, is getting something off your chest is really helpful. But if not, then go to the GPs, who can then refer you if they feel they need to give you that extra support. And as you said, that people like yourselves can put the scaffolding in place to give you those building blocks.
Yeah, absolutely. And the important thing to say is that across the board in relation to psychological well-being, for sort of more mild to moderate levels of distress, we know that talking therapies, psychological therapies are effective, and we know that they should be the first line of treatment over and above, say, medication. But it's also about patient choice in terms of what people would want. So in the first instance, there can be guided self-help, so there can be relatively few sort of appointments, and that might be helping people to sort of manage stress, as I talked about before. But also there can be guided help to help people improve their ability to self-soothe and be compassionate towards themselves. And for other people, they might benefit from a more in-depth type of talking therapy, like cognitive behavioural therapy, where typically we might see someone for sort of 12 to 16 50-minute sessions and have that private space where they can talk with the therapist, and the therapist can use their expertise to not only give them additional sort of self-help techniques, but really provide a space for them to work through how they're thinking and feeling about themselves, and have the tips as well to manage other people.
Well, thank you, Andrew. It's really interesting, and I think it's for me the message that comes out is the fact that if you do feel there's you're not happy about something, is don't dismiss it yourself, is to recognize it and then look at how you can then go towards sorting it out rather than struggling along.
Yeah, definitely. And I think as part of preparing for this, I put a few sort of simple tips that people can follow as well. And some of the things that I said earlier around what happens when we become stressed and how our bodies get geared up to deal with that, such as like making the social comparisons with other people. We can start to become our own psychologists as well, and think if we can shift ourselves out of doing that, if you're getting locked on to doing something like that on social media, for example, that can become that, you know, we do it because that's how our systems work, but it can become a bit unhelpful in the same way that's like a moth that flies into the light. It doesn't, it's sort of compelled to do that, but it ends up with a sore head. And the same happens to us. We end up with a sore heart if we make these sort of social comparisons.
But you've got to be strong with yourself, isn't it, to recognise that, I think. So
yeah, I mean, and self-care is not always easy, is it?
No.
And
we might know what we're meant to do, but
yeah, I mean, sometimes we don't know what we need to do. So I think self-help could be useful to give us those tips. If we are struggling to go back to what you were saying earlier about when to seek further support, if you are feeling particularly pessimistic, then and you are struggling to self-care, that can be difficult because you might, by very nature, think that nothing's going to help. At that point, I'd really encourage people to talk to your GP, or if your specialist physician, whether it be a dermatologist or dermatology nurse, about that, because there really is help that is available.
Well, thank you very much, and I do hope this has been very helpful to people, because I think it's shed the light on to go and talk to people. So thank you very much, Andrew, and hope to see you again. Thank you.
Ditto. Thank you.
Everybody.
Bye for now.
Bye.